do a review of the exam 2. The exam 2 will be Thursday, right here. So I put on the eCampus 3 sets of the practice exam. I think you already read something, or at least. Now in the exam, it will be very similar to the practice exam, which means at the beginning, I will give you all the bacteria name. So you don't have to worry about spelling, but you do need to know the name. And then I'll give you lots of case studies. It could be short, it could be long. Some of them are very similar to this. Okay, so we're going to talk about all these case studies one by one. And something are important, I will be still draw on the blackboard again, and I'll mention to you. So you can do a very rough review, and I hope you get a good one. Let's look at the question number 1. A case study, John, English instructor at the university. Adult care, 74-year-old people. Okay, that's old age. His mom's experienced chest pain, chills and fever. When he arrived at the daycare, she seemed to be short of breath and cough. And then they do the sputum sample, do the analysis, which is alpha hemolytic. And gram-positive diprococcyl catalase test and negative, and the optica susceptible test. Okay, here is this pathogen. I don't know, okay, we do it. This patient had a cough, chest pain. It's an old people, 74-year-old. And they do gram stain of sputum sample. What they find is gram-positive diprococcyl and alpha hemolytic and susceptible or sensitive to optican. Okay, what is this? Can you tell me in 15 seconds what is this? Which pathogen caused this disease? Is that clear? It's already tell you it's ammonia. So what is that? It's Streptococcus pneumoniae. Okay, so we write here Streptococcus pneumoniae. Okay, what we are going to talk about here is gram stain, positive diprococcyl. Okay, on blood agar, it is alpha hemolytic. Okay, what else we talk about? It's on the, we call it a special identification. Here we talk about the optica. What's the other name for optica? Or what's the major components for optica in testing method, which is we call it a P-disc. Is that right? This is susceptible. Okay, that's the first one. So this is, you can do a conclusion when you read on your notebook. That's the first one. And I'm helping you do this. Okay? It's very easy. Second one. A 4-year-old boy from regional hospital. He had a headache, stiff neck. Okay, this boy is headache, stiff neck. And I said stiff neck usually. It's indication something happens. And had a fever, 103F. And then they go to do a sample on the blood and the chocolate agar. Find it's only grow on chocolate agar. If they only grow on chocolate agar, what that means? It's a fastidious bacteria. And then they need X and the V factor. chocolate agar. So what does this mean? This is the fastidious bacteria cause meningitis. Which pathogen causes meningitis? And typically for a 4-year-old boy, and I said the pathogen cause number 1, meningitis, the childhood disease in the United States. And what's the name of that? Can you tell me? I want some reaction from you. I do not ask questions too often in the classroom because I don't want to waste time. But here I do want some reaction. Which pathogen is this? Which one? Haemophilus influenza. Okay? The second one is Haemophilus influenza. So how do we know? Number 1 childhood disease in the United States for kids, 4-year-old. Okay? XV factors. X factor is NAD, V factor is hemi. And it's a very fastidious bacteria, only grow on chocolate agar. And you will see it has a very typical symptom of meningitis, which is headache and tough neck. Okay, so these are the things you should take a note. Okay, question number 3. So I take these off, and we are going to do analysis, and then we write down some of the key things. Okay. Question number 3. This is related to the female. The female taken to the hospital. His condition is worse. Had some fever. However, he had a rash and a sudden drop in the blood pressure. Okay, when the female has blood pressure drop dramatically, this is kind of like a hypertension. Sorry, any other. Blood pressure drop. And then you have a negative test for sepsis, the bacterial meningitis. So it's not sepsis. What is sepsis? Blood stream or the blood vessel has bacteria there. And the bacterial meningitis, so it's not a meningitis. Her history was significant in that he was experiments using a new contracted sponge. Okay, it's a very contracted sponge. Has not been removed since the previous evening. Now, in other words, she's in a period of time. What organism is most likely to cause this one? Yes, Staphylococcus aureus. This is kind of like a shock. Toxic shock. So what do you call it? PSST1. Okay, here comes another table you should know. Staphylococcus aureus. We're going to fill this table, okay? Staphylococcus aureus gram stain. What it looks like. It's so positive. Okay, on blood agar. It is beta hemolytic. How about on mannitol salt agar? That is yellow colony, if you remember. Because mannitol fermentation positive, so it's yellow color. Okay, now what else in it? This should be susceptible. Okay, we're going to fill this table with your conclusion. So Staphylococcus aureus, and this guy, typically for PSST1, caused toxic induced shock and relate to 9070 using a very highly absorbent tampons. And I mentioned about that. Okay, so that's why you have to take some notes. A gram-positive coccus, let's say question number 4, was isolated from 37-year-old female, has UTI, which is urinary tract infection. Laboratory tests included the organism grown blood agar with no hemolytic zone, and the catalyst test negative and the serological typing to Rebecca Lansfield group D. This is easy. Here we're going to put another one, Rebecca Lansfield group. So Rebecca Lansfield group, do you still remember them? What is group A? What is group B? And what is group D? Okay, this one is group D. This already tell you, you should do this in 5 seconds. Which one? Enteral. Enterococcus faecium. Okay? So that's group D. Okay. Question number 5. Alternative year of the sexual active female. That's sexual activity person. Comes into student health clinic center complaining of painful and frequent urination. That's called dysuria. That's another name for urinary tract infection. And then they do the microscope observation and find this gram-positive cocktail in grape-shaped cluster and was catalase tested positive and resistant to novel bowel syndrome. Which one? What is that stuff? What is that stuff? So when you see catalase tested positive, this is all catalase tested negative. This is all catalase tested positive. So that's Staphylococcus. And also can be confirmed it's gram-positive cocktail in grape-like cluster. And it's resistant to novel bowel syndrome. Then what's that? We have a nickname for that, for sexual activity female. We call it honeymoon bacteria. Remember what's that one? Staphylococcus, Staphylococcus. Is that right? Okay, can you view all these? Gram-positive, blood alpha, alpha hemolytic, manidosarca agar, colorless. How about this one resistant? Okay. Remove this resistant. Why we can test in this one so quick? Because this bacteria resistant to novel bowel syndrome. Others are relatively is sensitive. Okay, which else the Staphylococcus we didn't mention? Staphylococcus acridens. Acridens. Yes. Okay, gram-positive. This is alpha hemolytic. This is also colorless. And this is also S. Okay? This gives you a conclusion of everything for Staphylococcus. So let's talk about the others. Let's see this one. Question number 6. 20-year-old pregnant female gave home delivery using a midwife. At the little medical intervention, delivered a healthy 7-pound baby boy. On day 5 postnatal, the baby was experiencing tremors, vomiting, normally rapid beating of the heart, refused to breastfeed and had a fever of 102 Fahrenheit. Okay, then they do cerebrospinal fluid, the blood was cultured, and find it's gram-positive, catalase test negative, beta hemolytic cocktail. And this one is resistant to the basic tracing. What is that one? Which patient is this? This is for newborn baby. And the delivery at home with limited medical intervention. And the newborn has kind of sepsis. And then we staining it, find gram-positive, catalase test negative. Once we see catalase test negative, it's going to be streptococcus right there on the top, not streptococcus. And then we see it is beta hemolytic. Okay? What's that? Okay. Streptococcus, ag, right here. So, gram stain, positive, chain shape. Beta hemolytic. Okay, then they do. This isolates was resistant to basic tracing. What's the components of basic tracing? What's the other name for this? Is that called ADIS? This one is susceptible. Okay. Then you do the review by yourself. Rebecca last field group, what is this one? Group B, is that right? This is also called the GBS. But how about Streptococcus pneumoniae? Did they belong into any of the last field group? No. Because there's no M protein on cell membrane. So they cannot belong to any of the group. Okay? That's question number 6. It's GBS, Streptococcus agalactiae. And we also call it group B Streptococcus. Okay, question number 7. A Honduran mother had her 5-year-old across the United States stop a freight train from Mexico by the U.S. immigrant authorities. Okay, have a neck swelling. This is the immigrant kids. Neck swelling, blackish, greenish membrane in the tonsil area, and the gram-positive club-shaped arrangements on blood agar with thyroid. The swab was a culture and has not received any of the childhood vaccination. What is this one? So what's the key here? Immigrants, no vaccine required, and the ball neck, cedal membrane, tonsil area, and you will see it's gram-positive, club shape. Okay, which pathogen is this? Corynebacteria diphtheria. Okay, so this is very simple. Remember AB toxin. Remember vaccine DTaP. Diphtheria, Clostridium tetanus, Aeseria, and Bordetella pertussis. Okay. And thyroid blood agar using for transport media. The transport media found in the isolate on there. It should be showing you black column. Okay, this is easy. Question number 8. It's a short one. From your patient list, which one is post-surgery infection belonging to a group antibiotic-resistant bacteria known as MRSA, methicillin staphylococcus, Staphylococcus aureus? So, like this. You should take notes right here. MRSA. Okay, is that easy? That you can have a table by yourself. Then when you see the question there, just write notes there. Then you easily to be doing the review. Okay, in Yavapai County, Arizona, 13-year-old boy in 8th grade was culture confirmed positive for pertussis and had attended school during his illness. Okay, this is the pertussis, Bordetella pertussis. To identify others who may be infected, the probable clinical confirmation was established for other students in that middle school. What kind of criteria the clinical confirmation needs to be? This is tested you how we should do to identify bacterial petesis. Do you still remember what we should do? What's the confirmation test we're using? We're using PCR and we're using a nasopharyngeal swab. It's a Dacron swab put on the nose, and the depth should be 2 half between earlobe to the nose. Okay, so the question is B. The answer is B. Question number 10. The culture-based screening method for the prevention of systemic GBS infection recommends what? It's very easy. I talk in the class. Screening pregnant women for vagina and rectal GBS between pregnant 35, 37 weeks. So the answer is C. Okay, the question number 11 is so simple. I just said half the distance from the nose to the earlobe. So the answer is C. Is that right? Okay, from the pathogen list, which organisms are now considered part of the United States recommended childhood immunization schedule? What are they listed? Okay, let's look at these answers. How about A? Streptococcus pneumoniae, do they schedule? Okay, how about L? Which is L? Staphylococcus staphylococcus, probably not. They're not for kids. So the A is gone. Let's look at the M. What is M? Haemophilus influenza, yes. Okay, N. Klebsiella pneumoniae, we don't have to do that. As I said, it's 2% of the United States person will get pneumonia is from Klebsiella pneumoniae. So the answer have N is gone, have L is gone. We left C and B. So let's look at something. Let's look at B. What is B? Streptococcus pyogenes. Oh, I don't think so. Otherwise, you guys won't have an excuse for strep throat. Is that right? So then, what is that? AMOP. So what is A? Let's look at that. Streptococcus pneumoniae. M. Haemophilus influenza. O. Corynebacterial diphtheria. And P. Bacterial petesis. Okay, then you say you maybe forgot something. Is that right? Okay, then we go back to see the slides, what they are talking about. So this time, we're going to go back to see the slides. Where we should find it is right here. And let's go back to see the slides. And I'll show you where we talk about this. And I said that this one is important. Let's go back to right here. This is an important part. Is United States scheduled children immunization, and you can see what are they mentioned. Okay, so those are the things we just remind you that you go back to see the slides. Okay, we don't have, let's say last question. What etiological agent is responsible for childhood peritonitis, tonsillitis, sinusitis, otitis, and superactive skin infection with sequelae such as active rheumatic fever, and glomerulonephritis? So which pathogen will cause a severe sequelae, which means even you recover, they still have something? And rheumatic fever and glomerulonephritis. Which one? Is strep throat, Streptococcus pyogenes, because it's very invasive. So the answer here is Streptococcus pyogenes. Okay? So this is one set of the question. Help you to understanding all these case study and study all these characteristics of the bacteria and the possibly you're going to have to feel here. We finished right here. We haven't finished on the top. So let's go to see the practice exam 2. So I also want to mention, it could be the case study, it also could be some very short story, like practice question 2. So we want to talk about all these. I remember the one question I probably didn't mention, so we want to talk about all these. can grow on bioacetylene agar and the hydrolysis, carbon hydrated acetylene become acetylene which one? Aterocarboxyl. Okay, this one will be hydrolyzed acetylene become acetylene. It can grow on the bio salts agar and acetylene become acetylene and it turns black. So the answer is aterocarboxyl. Second question. Can produce toxic shock syndrome by celebrating a toxin referring to. When you review, don't look at the top. Give yourself some challenge. Just fill the blank. This is like you're running, like let's say 20,000 meters. Then you go up to have a game, which is 1,000 meters. Then it's easy to run. Theoretically, okay, of course there's different strategy. Is that right? That's how we'll do if I'm student. So I'm not going to look at on the top. I'm just feel. Then I go back to see, look at the top. Which one I'm missing? Then this gives you practice question a little bit difficult in the exam, because in the exam you can look at the top. Then you cut. You can cut your paper. The top, you just cut it. Okay, then you do these questions first to see how many you still remember. And when you do review on Wednesday evening, you can do the same thing. Is that right? You still cut. You ask your question again, then look at the top. Are you familiar with all these names? Are you familiar with these characteristics? What are the diseases related to that? So that's the way you can study. So let's say I don't look at the top, okay? Which pathogen causes toxic shock syndrome, and by elaborating a toxin referring to TSST1. We wrote it here. Remember, we just finished. So Staphylococcus aureus. That's how you're going to study. Pathogenic forms and may produce beta-hemolysin and an enzyme called coagulase. Okay, here I'm going to be doing one more thing, coagulase. Which one is coagulase testosterone? Which means you're going to cause some glue-like symptoms. The blood cell is like gluing. That's related to toxic shock. Is that right? Staphylococcus aureus. So this is positive here or negative. Okay, that's you can fill this table again, make it a little bit longer. Catalase test negative, number 4. Catalase test negative, gram-positive cocktail belonging to group A, susceptible to basic